I'm so excited to welcome Dr. Tabatha Barber, aka the Functional Gynecologist, back to the Core Connections podcast. So welcome, Tabatha.
Yay, thanks for having me back. I'm super excited because we always have such good conversations.
We do. I know we were chatting before we were starting to record. I was like, okay, we just got to get going. Otherwise, we'll just talk forever. So today, what I really want to talk about is let's go deeper with some pelvic floor conversation. Everyone listening knows that comes up all the time in conversation because our pelvic floor is so important for our overall health. And there's a lot of things that come up that, women don't even know about or have no idea is possible from interventions and medical things that can help them with their pelvic floor. So I want to start off and just have you share, because I noticed that you did the laser therapy or laser treatments. I don't know, I'll let you phrase it the way you do for women for their pelvic floors. So can you just tell us what that is all about, how that is beneficial, and why women might want to consider doing that?
Yeah, it's such an innovative technology, and I'm so excited to finally have it. Like, I've wanted a laser in my office for years, and as soon as I went out on my own, it was like my first big purchase because I know what it can do for women. It's just amazing. And honestly, it's for all women, especially women who've had babies or menopausal. But I would say we could all benefit from a little support down there. So essentially, they took, we've been doing laser therapy on skin for decades, especially the face. We do a lot of facial treatments to tighten up, lift our skin, make it look newer, fresher. And somebody had the brilliant idea, why don't we see if this works on the vaginal tissue? And, they did a ton of studies and research and finally brought it to market in the past decade. And it's just transforming women's health because that tissue is very responsive to our health, our nutritional state, our hormonal state. So like all of the things that we go through as women, being on birth control pills, having children, going through menopause, these all change the state of our vaginal tissue and our supportive tissue in the pelvis. So our collagen structure, all of that. And the laser can rejuvenate that so that we grow new cells down there. And so it's kind of like you're getting your old vagina back, That's how I like to think of it. And it helps with dryness, painful intercourse, leakage from the bladder. We lose support down there just from carrying babies, from having like a chronic cough from asthma, heartburn, things like that, or being overweight, carrying extra weight, or then menopause when you start having less estrogen and progesterone. There's receptors in all of those tissues for those hormones, and when you are depleted, it changes the structure down there. And so laser therapies is one of the best ways to rejuvenate that area because, surgery is a big deal, right? And, Erica, I was a surgeon for over a decade. I love surgery. I love being hands-on, but it's not always the best first option for women. It's super invasive. Like, it takes 6 weeks of downtime to heal from that kind of surgery. You can't do your exercises or lift anything or do anything too strenuous or definitely have intercourse, anything for 6 weeks. And then especially after menopause, women will use like vaginal estrogen cream to try and help that area down there so that it's not so dry and painful, so that you're not having leakage. And some women have decent success, but honestly, I get a lot of complaints from my patients that it's annoying, it's cumbersome, it's messy, it interferes with trying to be intimate. It costs a lot because they have to pay a copay every time they get their prescription filled, and then you have this whole other section of women who've had breast cancer or are nervous about cancer, and they don't want to put hormones in their bodies. And so the laser like takes care of all those issues. It's pretty awesome.
Oh my gosh. I'm like, where do we start? I want to unpack
Right.
so much of what you just talked about. So with the laser, let's stay focused on that just for a moment. Like, what does that entail exactly? Like, is it one treatment? I'm assuming it's multiple treatments for best results. And I'm assuming it also depends on what that woman's, going through health wise and with her pelvic floor and all that. But can you speak a little bit more to that so women listening can feel like, okay, is this a one-time thing, or am I going to be committed for 6 months, or, what does it really take to help improve some of the symptoms of pelvic floor dysfunction?
Yeah, so you hit the nail on the head. It's individualized for sure, but there is a standard recommendation of 3 treatments 4 weeks apart, at least with the Cyton Diva laser that I use. That's my favorite because of the hybrid dual laser techniques I'll talk about. There are different technologies. There's the Mona Lisa touch and radio frequency, CO2. Like there's different technologies. So you want to make sure you know what you're getting into with your physician. But the goal is always the same. So 3 treatments 4 weeks apart is going to give you the maximum effect. But I will tell you, I have patients who after the first treatment, they're like, oh my gosh, I can do jumping jacks and I'm not peeing my pants anymore. And I can jump on the trampoline, or I can have sex and it doesn't hurt anymore. It's like waterworks down there. So everybody's a little different. And the generalized recommendation is that you do a once a year maintenance. I would say that's more for menopausal age women, younger women who have just had babies and want a little extra support. A lot of times they just do the 3 treatments and then they're good for 10, 15 years, that kind of thing. So everybody's honestly different. It depends on your nutritional health, whether you smoke or exercise or carry extra weight. And genetics plays a little bit of a part with how strong your collagen is, that kind of thing.
So I know you said like for women, postpartum, how early can a woman postpartum actually go get her first laser treatment? Does she have to wait a certain amount of time?
I would at least wait the 6 weeks, which is a general recovery time period for delivery. In case there's any complications from the delivery, you don't want to be confused, because with the laser treatment, you can get a little bit of bleeding and spotting. But that's pretty minimal. It lasts 1 to 3 days. I just wouldn't want to confuse a picture of someone who was having postpartum issues, right? And the uterus and cervix have to contract down to their normal size. So that all requires about a good 6 weeks. So
Okay. Yeah. Thank you for clarifying. I think those are really good things to be aware of. So from hearing that, then what about, even women, okay, so obviously postpartum, right? There's been a lot, if they've had a vaginal birth. What about women who have had, say, a cesarean? A lot of women who've had cesareans don't initially think they have any pelvic floor dysfunction, but almost from that preventative perspective, because she has had weight on her pelvic floor for those 9-ish months of pregnancy. And as obviously I have learned through all of my studies and working with so many incredible women over all these years, is that so many women do have pelvic floor dysfunction. They just don't know it. So what do you say from more of that kind of prevention perspective?
Yeah, so that's such an important point, because back in the early 2000s, it became really popular to have elective cesarean sections. So that was all the rage. You didn't want to destroy your vagina, and so you just scheduled an elective C-section. And so studies went on, and eventually this was super popular in Brazil, particularly. Their C-section rate was sky high, and then we got enough numbers that they started studying the results. And what they found was that those women who had elective C-sections still had prolapse issues and destruction of the supportive tissue of the pelvis, because it's not just the act of giving birth, but it's also carrying the baby for 9 months, like you mentioned. So, you might not have a tear that has to heal or anything like that, but you're going to have loss of support of that deeper collagen tissue for sure. And, for a lot of reasons now, we don't do elective C-sections very often anymore. Like we came full circle and we realized it's not good for many reasons. The baby doesn't get the mom's microbiome. They don't get a healthy gut health start to their life. The list goes on and on. But anyway, I would say, I just did a diva laser on someone recently who hasn't had children, because she has been noticing like, hey, things feel a little bit different down there. She's a heavier exerciser. She likes to lift weights and do all that kind of stuff. And she wanted to be proactive and preventive. And I thought, that's amazing. Like, everybody should have the ability to do that, right? I mean, the downside is it is a cash pay treatment. It's not covered by insurance, but honestly, most things that benefit your health and give you a vital life as a woman are not covered by insurance. You know that.
Oh, absolutely.
They
Everything's
want
out
to
of
keep you alive, but they don't want you to thrive. Like,
Yeah, I know. That could be a whole other conversation on its own.
yeah.
We can have one day about preventative care and doing things that are, I think, and just mentioning costs for a moment too. It's like, well, if you look at the big picture of things, and it's always kind of comes back to like, what are your priorities? And your health, I hope if you're listening, is one of your top like 3 priorities, right? Family and health probably in like the top 3, right? And so these things that like we're talking about today, with really understanding your pelvic floor and pelvic floor health, and obviously I teach the movement side of it because that's a big key part of it. But the reason why I wanted to get Tabatha on here to talk about this is because I have heard, I didn't even know until I think it was in the last year or so, actually learning some stuff about the laser for pelvic floor. And I was like, that sounds amazing, because it's just an added tool that could really help women, have a better healthy pelvic floor, which is good for so many reasons. And one of them, which will make this a good segue into, is I would love for you to share the importance of our pelvic floor health, from obviously having a healthy, sexual function and sexual life, because that's really important for our health, right? I've read amazing studies where they'll talk about like, if you have, basically can orgasm basically like 7 days in a row, like take a picture of your face on day 1 and look at it again on day 7, right? That oxytocin release that we do have, not saying that you should do that on a regular basis. That was just an example, right? So it means like on a, I don't even know, what is a healthy, from a sexual function, what is it? I know, it's obviously age and lifestyle can be a little different, but having some regularity in your life is very healthy because of the hormone release that you do get. And so anyway, I want to hear what you have to say and your thoughts from your functional medicine perspective and understanding the pelvic floor so well like you do.
Yeah, it's so important. I mean, I want women to understand that things like the vaginal laser treatment is an investment in your future, in your relationships, in your health, because if you are avoiding exercise because you're going to pee your pants or feel pressure down there, then you're going to not be your vital self. If you're avoiding intimacy with your husband or partner because it hurts, you're, like you said, you're going to be losing out on that relationship. Unfortunately, I've seen so many women, especially even younger women in their 20s and 30s, have babies and be so uncomfortable down there just from the dryness of nursing because they're in an estrogen deficient state, or they have scarring from their tears and it's sensitive down there. They get into this pattern of avoidance of intimacy, and it does affect their relationship. And that is a huge deal. Like, I just think of the divorce rate, and you want to raise children to see a happy, healthy, beautiful relationship between you and your spouse or your partner. And intimacy is a core part of that. I mean, that is how we're connected as humans. And a lot of times we shut down or we avoid because it hurts, because it's no longer comfortable. Or some women just don't feel sexy because it looks different or feels different down there, right? And so they just start avoiding. And we got to nip that in the bud. We got to have those conversations. You need to find an obstetrician or gynecologist you can talk to about that, because you shouldn't be missing out on that part of your life. It's a normal, beautiful part of a relationship. And I will tell you, that is how most men, I don't want to generalize too much, but most men feel connected to their women, right? That physical connection. We try to talk to our husbands and they get it a little bit, but they feel loved and connected with us through those intimate acts. And so we have the ability to change those relationships. And I think that a lot of women aren't thinking about that because they're sleep deprived, they're tired, they just had babies, they went through all this stuff. That's like the last thing on their mind. And then 2 years later, their marriage is super strained and they're asking why, and they're trying to figure that out. So, I mean, this goes way beyond just like pelvic floor health, but it affects all aspects of our life. And I think it's important that we talk about this. In addition to doing the laser, I do O shots, which is for better sensation and hopefully better orgasm, because those nerves down there can get destroyed with childbirth and excess weight and all that other stuff, or just poor nutrition. So we actually will draw up some blood, we'll spin it down in the centrifuge and get your PRP, your platelet-rich plasma. And I inject that directly into the clitoral hood and to the G-spot under the urethra, and it has new nerve growth for better sensation, hopefully better orgasm, like you mentioned. It's so good. It releases oxytocin. You feel happy. It's the love hormone, and it makes you healthier for sure.
Yeah, but this is why I know relationship conversation goes way, way, way beyond what we're talking about today. But I think this is a key piece that doesn't get talked about, because as a woman, we address so many other areas of our body, but the pelvic floor gets ignored. Or again, you go to your OBGYN and she's like, well, just do more Kegels. And like I've talked about before, that could actually be causing part of the problem because we're not correctly activating the pelvic floor. And that's why I'm all for let's think outside the box. What else can be done? And things like that. So I think this is such an important conversation, because so many times when I hear from women, like their pelvic, it can be painful down there. I think that's a big one, right? I don't know what your percentages of women you run into that do have pelvic floor pain. But I think it's more common than we would realize. And I know for me, with my first, I had an unnecessary episiotomy. And that took 9 years for that scar tissue, 9 years. And I was like, and I shouldn't have had an episiotomy, but it was one of those, I had an old school doctor. It was like, don't ask, don't tell. We didn't talk about anything that I now promote inside of our prenatal program. We talk about all of it. We want women to know that you have a choice of what is going on with your body, right? Sometimes we do have to have an emergency C-section, but that's why they're there. They're there for needed reasons, right? But this is such a big key thing that I think is so important that we talk about this just to a deeper level. I know you mentioned, and if you have anything else to say to this, go for it. Otherwise, I want to jump into how to talk about like that perimenopause, menopause time a little bit.
Yeah, I would just say that the laser can treat, the scar tissue pain. Sometimes nerves will get trapped in that scar from an episiotomy or a tear. I hate to describe it like this, but it's kind of like hamburger meat down there after you deliver a baby. And so putting it all back together isn't the prettiest situation, and mom's bleeding and moving, and So as an obstetrician, we just do our best and quickest to get out of there because she's like trying to close her legs, So if you feel like you have pain or scarring that isn't resolving, you need to seek help because that's not normal. It could be that you just need that revised or that you need laser treatment. And if you feel like you're getting poo-pooed or ignored, then go find somebody else because you really shouldn't be living like that, right? And avoiding things because of it. That's not okay.
I couldn't agree more. I second that. Go find somebody else. Okay, so let's talk about this perimenopause to kind of menopause phase of women's life because, right, our hormones start to plummet or they're all over the place. And obviously we know with low estrogen, women their vaginal wall tends to dry up. And I know you mentioned, right, that the laser can be helpful. So just to reiterate, you said doing a treatment of three, one every 4 weeks. But then once you're in that menopausal phase, doing it from a maintenance perspective. Is there anything else that you also recommend for that perimenopause to menopausal woman as dealing with any sort of pelvic floor issues, or maybe even if she doesn't know she has pelvic floor dysfunction? Because that's the other thing too that we should hit on a little bit is that I think so many times, as time goes, you start to think things are normal, even if there's no pain or actual dysfunction. Does that make sense? Which probably comes down to what you mentioned with the sensations being lessened.
Right, exactly. So things can change so slowly that you don't necessarily notice, but you just realize I don't really enjoy things the way I used to. I don't get the heightened sensation or the pleasure. Honestly, not all women orgasm, they should be able to, but some have never actually enjoyed intercourse. And that's a whole nother conversation. And I will tell you, those women, they should start to work with themselves. They should masturbate. They should figure out what brings them pleasure because there are women out there who have never enjoyed that. And if you can figure out what you like, then you can start to maybe talk to your partner about that and work on that. But I will tell you that it is normal for your sensation to go down a little bit as well as having more dryness. And so you got to use it or you're going to lose it. That's the thing, especially during menopause. That tissue will contract. It will get tighter. It loses its elasticity. So when we have intercourse, the vagina lengthens and moves, our uterus tilts, and things can't move like that when they don't have the hormones that they used to. And so that can be part of the pain as well, not just dryness. So, the doctor will say, oh, just use lube. But that's not all there is to it. So, or things will start to fall, your bladder's pushing out or your rectum's pushing down into the vagina. I have women who will tell me it feels like I'm going to poop when I, am having intercourse because he's pushing on that rectum, and that is really uncomfortable and embarrassing. I don't want to have an accident. And these are real things that women don't talk about it in public, but I want them to know, you're not the only one. I promise you, I hear all kinds of stuff, and that is really common to feel insecure with the actual act because you feel like you're going to pee or lose stool or anything like that. And it doesn't have to be that way. Your core rehab program is amazing. They can work on the structure and the strength that way. And then the laser also hits the deeper collagen levels, which is the supportive tissue deeper to the vaginal tissue. And so there's ways to feel more supported, you're not going to lose your functions during intercourse because it doesn't have to be that way. But nobody can help you if you don't speak up. So that's why I want women to know, you're not a freak, you're not alone. This is super common. Reach out to us for sure.
Thank you for sharing all that. So I
Yes.
have a couple of questions that have come up with my core rehab students, and I'm not necessarily an expert in some of this. I know a lot, but what are your thoughts about devices out there that are supposedly, they like connect with their phone, or they have a little app, and they're helping you like do like pelvic floor exercises because I don't know. I've never used one. I've seen them. I have my thoughts on them without having used them. I'm curious your thoughts on them. Are they beneficial, do you think? Like,
I have not used them either. How do they work? Like, you put a little sensor in the vagina, or what? How?
that's the gist of it. Yes. And so and I don't know if it gives you some feedback a little bit. I mean, there's just different ones out there on the market. And I was just curious your thoughts on them, if you had used them or had any patients that have
I
used
have
them.
not. That sounds like it would be full of technical and user errors, right? Like, I just think of something like urodynamics is a test that we do in the office for checking bladder leakage and things like that. And we put sensors in the bladder, in the vagina, and by the rectum, and it senses nerve, movement, functionality, but you have to be super careful and put it in the exact right spot, or you're going to get the wrong reading. If you put it in an inch deeper, you're activating a different muscle and reading a different muscle interpretation. So I would think that it would be confusing for women, to get this feedback without some kind of guidance. So I guess it depends on, is there somebody guiding you and like helping you interpret these results? I mean,
I don't think so.
Interesting technology. I don't know. You're going to have to try it, Erica.
I know. And I just need to try them. And so then I can make a decision whether I like them or I think they're actually do more harm than good. Okay. The next piece to this is, what are your thoughts on women using a vibrator to help to stimulate more collagen and fascia and just waking up the nerves down in the pelvic floor area?
Yeah. So there's two thoughts I have on that. Initially, anything that you're doing to stimulate blood flow to that area, which is usually, enhancing the sensation, bringing blood flow to that area, is good. That's why I say use it or lose it, because the more you can regularly stimulate that area or use that area, have blood flow to it, you're going to keep those nerves healthy and, regenerated. There are people who say that if you use something like a vibrator, because it is so over the top, as opposed to manual stimulation or something a little slower, that it becomes women become unable to enjoy the pleasures of their man or any manual stimulation. I would say that is, a very individualized decision. If it's going to help you figure out how you feel better and what feels good to you and get that blood flowing down there, you want to feel engorgement down there. That's part of orgasming, is you'll feel a swelling. Sometimes you might even feel the uterus contract or the vaginal walls. Like, those are all good indicators that your blood's flowing down there. And if it takes a vibrator to figure that out and make that happen, then I say use it, because you want to do whatever's going to stimulate that area and get you healthy. But don't be afraid to just use your hands or use your partner or whatever, but do something, right? Do something.
Do something. That's what, like, my whole thought process with the vibration is that I know how fascia and the body in general responds with vibration. It doesn't have to be intense. That's it. Like, I'm glad that you said that too, because that was the other thing I was thinking, is it doesn't have to be intense. Even like a really gentle vibration, I think could be very effective and helpful for women. So that's where if anyone's concerned about it being too aggressive, then do something that's gentle and, just gentle for your body. Because again, sometimes I actually feel like less actually can be more, and that gentleness could help you be calmer and ease into things and actually wake up that tissue down there and maybe get some of those nerve endings to kind of stimulate, because you're like getting that blood flow down there. Or if it's too intense, it actually could cause her to like just almost tighten up, right? If it's too much. So I think that's a really big thing to be aware of, that there's so much out there. I'm no expert in that, but I just know the body and, from that perspective. And I know vibration is really good for our fascial network anyway. So I would assume that it's really good also for our pelvic floor. Like I have a big, plate, vibrating plate that I stand on. I do that not every day, but so it's for full body vibration. And so it's very interesting to get on there. And I'm always like trying to think about, okay, I'm connecting my pelvic floor lightly while I'm on there, because it is stimulating all of that, because it gets the whole body, and it's really good for so many reasons. You're lymphatic and all of that. So anyway,
we have that in the office too. We have that in the office, and I will tell you, like, you have to empty your bladder before you get on that. And it's good. It helps you contract and tighten things up. So
yes. Yeah. Oh, well, let me ask you this too. So I'm coming up with all sorts of questions for you. So you just have to tell me if you're like, too far. But like doing some, rebounding, like the trampoline and things like that. Like I know from my perspective, I don't encourage any trampoline usage until we're not having any leaking and we're learning how to connect correctly, right? Because if you're leaking and something like that. But do you recommend that to patients? Like once obviously they don't have any symptoms of pelvic floor dysfunction, are you a big fan of the rebounding, like the little trampolines, that you can get at home?
I'm not. I think that anything where you're putting continuous pressure on the urethra, either with carrying extra weight or have a heavy lifting job or just the physical jumping, I don't purposely want them to seek it out to do it. But then there's the other part of me. It's like bone health. We want to stress the bones a little bit. So that's why I like the vibe plate, because it's kind of a nice in between. But,
it is.
I have kids. We have a trampoline. I want to be able to do that kind of stuff. So just your regular day to day, I don't think you should avoid it for sure. I think that you want to just be able to live a life without symptoms and, limitations, that kind of thing.
I agree with you wholeheartedly. Yes. And the vibe plate is amazing. It's so good for full body and for pelvic floor. But we got to avoid that stuff when we are having symptoms. Something that I'll just throw out that I would recommend to women, if you are, once you get to a place and you're able to do some jumping on a trampoline and you want to do that with your kids, is afterwards doing some light inversion work, like getting those hips up and doing some of that stuff. I feel can be a good, like, okay, now that we've really kind of stressed the pelvic floor, let's spend a couple minutes and make sure we're really connected well. And so things are going back where they're supposed to go. That's just my little nugget.
Do you recommend that they engage those pelvic muscles before they jump? Like that's what I do intuitively. I like tighten it all up and then I jump on the trampoline. So, okay, cool.
Yeah, you want to be connected. I always say that too with like, if you feel like cough coming on or a sneeze or anything like that, where maybe sometimes you do leak a little bit, is don't overactivate, right? But finding that light middle ground so you're supported, and then you laugh, you sneeze, you jump, whatever it is. Because if we're not, because especially in the beginning when we've been dealing with pelvic floor dysfunction, and again, most women don't activate correctly, because that's part of this, right? It's like actually learning that like brain pelvic floor connection. And so in the beginning, you have to be so much more aware of it. But after a while, you just intuitively do it. Right. Which is what you're saying. Like you just automatically, you can tell without even thinking, oh, my pelvic floor connects more when I'm going to go jump on a trampoline, because your body's like, we need to be connected or not good things could be headed our way kind of thing. You know what I mean? Yeah. So you do want to work on having that support. So, oh my gosh, this is such good conversation. So Tabatha, do you have anything else that you want to share around what we've talked about today, or any last tips to share with?
Oh my gosh, Erica, I could go on all day about anything. I really have been on a kick lately for women to just feel empowered, like figure out and stop being ashamed and start asking questions and just figure out how to be your best you know? And that's why I was saying, you know what? If you have never enjoyed sex, start masturbating, figure it out, like figure out how to enjoy life and yourself, you know, and then connect with your partner. But I just think that we have shamed women for too long. We all think we're like going through this alone and we're the only ones. And carrying babies is hard. Having babies is hard. Going through menopause can be difficult. And there is help out there. You know, there are so many beautiful people like yourself helping women through these transitions so that they don't have to suffer. They can actually enjoy it the way they're supposed to. And so I think the important part is we just start having these conversations, you know, like, hey, I was miserable with that pregnancy and I didn't do well. And how many years later did you have your episiotomy pain? 9 years. Like, good Lord, let's not make another woman go through that. So I love that you are helping women, and I just want them to reach out. I mean, anybody can reach out to me on social media. I'm more than happy to answer generalized questions. Obviously, I can't give individualized medical advice unless you see me as a doctor, blah, blah, blah. But, you know, there are doctors out there who do know and will listen. It's just, it might not be the one you're going to, and that's okay. You know, we're all on a different journey. So I just hope people start sharing what they're going through and supporting each other.
Yeah, I mean, it comes up, and I'm so grateful for you, Tabatha, to share all of this, because it comes up so many times. I hear from women the same stories over and over again. I mean, with variations, and they write to me with just, you can tell they just feel defeated. They feel like there's no hope, right? And I'm like, oh my gosh, like I've never had a woman write to me where I'm like, I ever feel the same way, right? I'm always like, oh my gosh, because we've helped so many women in one way, shape, or form. And it's just incredible and amazing. And you and I get to see the other side, that transformation that women are going through. And I know it's sometimes hard to hear when you might be on the side of dealing with dysfunction and feeling hopeless, or maybe even not realizing like, oh, wow, you're describing me and I didn't really know I could do something about it, right? I hear that a lot of times too. And so all of that, and this is going to be the episode, ladies, I'm like, share this with your girlfriends, share this with your sisters, because we need to talk about this more. And every time I mention, and I do a talk about pelvic floor, and I always try to mention pelvic organ prolapsing because most women don't know what it is or that it's even possible. And that usually is a good wake up call for women, like, oh, I didn't even know that could happen. And so like what we're talking about today, I just think it's so empowering. Like you said, that we need to be having these conversations more. It's just so amazing. Okay. I was going to ask you just to refresh again, what was the type of laser that you use? And we'll put it in the show notes, because I know women are going to be like, wait, I'm like, I want this. Where do I even go about finding a doctor too, right? How do we know? Is there a way we can search like the certain type of laser? Is there like a main website for that?
Yeah. So Cyton is the creator of the Diva vaginal laser that I use. Cyton's been in the laser business forever, so I completely trust them. It's SCITON, and they have a list where you can see, you know, which professionals perform this treatment or have this device. I would say, you know, ask questions, ask for feedback on how people have responded and what kind of results they get, and do they have any issues or complications. But honestly, it is a low risk procedure. It's, you know, it's a superficial procedure done to tissue that heals up really quickly. I mean, it's amazing. It takes longer to numb you up than it does to do the procedure. So we put numbing gel in the vagina for 20 minutes and the procedure is like 3 to 5 minutes. And nothing in the vagina for 3 days, and then you're good to go. So, I mean, there's no downtime. You can exercise the same day. It's absolutely amazing. So I have women all over Michigan come. I actually have someone from Arkansas coming, which is funny. I'm like, really? You don't have a laser in Arkansas? But more power to her. So yeah, seek out a professional who is doing this laser. I use this one in particular because of the science behind the hybrid technology of the superficial laser helping the vaginal tissue with moisture and elasticity, and then the deeper layer hitting the collagen levels, where the older lasers that came out before that weren't really working on that supportive collagen. And so you don't get the benefits of helping your bladder support and your little, how the bladder and the rectum kind of fall a little bit. So that's all good.
Well, it sounds amazing. You've sold me on it. I'm going to have to go find someone just to try. I just want to try it. I just want to see, hey, who knows, right?
Girl, fly up and see me. I'll do you for free. It's all good.
I will. I would love to travel. Oh my gosh. So, okay, Tabatha, will you just remind everybody where they can reach out to you and find more information about you, especially if anyone is within a driving distance that they'd be willing to come see you?
Yeah, I would love to see them. And I do practice functional medicine telehealth. So if you do want to come see me, but my website is www.drtabatha.com. That's 3 A's, no I, Tabatha. Thanks, Mom. And I'm on Facebook and Instagram and YouTube at Dr. Tabatha. So everybody come check me out and just shoot me your questions, or send them to Erica and we'll do a question and answer episode. We've done it before, right?
Yeah, totally. We'll do it. And your Functional Gynecologist Podcast, you can't forget to mention.
Oh, yes. You can check me out, the Functional Gynecologist Podcast.
And you have a program. We haven't mentioned it yet. I want you to just share with everyone. I love everything that you do. And I know it's coming up. I don't know. You spill all the details.
Yeah, January 3rd. It's a 7-week program, comprehensive transformation. I mean, it's focused on getting rid of the belly fat and that kind of thing that we get from too much stress. But it's a hormone detox reset. So it gets you balanced, gets you back to how you should be, regains your energy, your sleep is improved, your gut gets healed. Like, it's amazing. By week 5, the women are always like, I don't want it to end. I want it to go on forever. And it's really awesome because we do like a 1-hour Q&A session where I talk to you and I guide you through the process, and it's pretty amazing transformations. So, and it's a sisterhood. So it's a private Facebook group where you're all supporting each other and you have accountability. And I just love that support from one another. It's just like beautiful. And so please join us. It's called Renew You Sisterhood. It starts January 3rd. The link is on my website. And I would love to see you guys all there.
Oh my gosh, it sounds incredible. Well, thank you so much, Tabatha. This was so fun, and we'll have to look at scheduling a live Q&A, and everyone can join us, and we'll answer lots of fun questions. So.
Sounds good. Thanks for having me, Erica.